Cataract surgery is one of the most commonly performed procedures in all of medicine, and it's something that we specialize here at Texas Vision. Cataracts is simply what happens to our lens over time. Proteins builds up in our lens, and we start to get a haze to it. This can happen at any point in our lives, from birth all the way to late in life, but generally this starts somewhere between our 40s and 50s. Here is your eye. The front of the eye is the cornea, the back of the eye is the retina, and inside of our eye there's a lens that focuses light. What happens in cataracts is proteins build up inside of our lens over time. When that happens, it begins to get blurry and cloudy. With a blurry and cloudy lens, your image isn't as good. So you start to see that as glare at night, images are a little bit fuzzy, maybe difficulty reading, and you just simply can't see as well as you used to. This is a one-way street. So once this protein starts to build up, it doesn't go away on its own, and it'll slowly get worse and worse over time. So at some point we need to fix it, and that's where we come in. We fix these by doing a lens replacement. We're taking out your old cloudy lens and replacing it with a brand new lens. This procedure has been around for several years. It's always been safe, and it's just gotten safer. The procedure itself only takes 7 to 10 minutes. It's outpatient, and it's one of the safest procedures we do. The risks are quite low. Risk of infection, retinal detachment, lens dislocation is between 1 in 200 and 1 in 1,000. We do one at a time, usually about a week or two apart. Years ago, we didn't have many options. We would replace the old lens with a new basic lens, and then you would go back into bifocal or progressive lenses to see clearly both distance and up close. But nowadays, as technology has advanced, we have a lot of new options. Generally, we have 3 basic categories of lenses. We have a basic lens, we have an astigmatism correction lens, and we have a full focus lens. All 3 lenses are good lenses. There's no good or bad, right or wrong. They're just different. And the differences in these lenses are how much you want to see without glasses. The basic lens is a clear lens, and it's a good lens. There's nothing wrong with the basic lens, but it doesn't correct any astigmatism and it doesn't correct any range of your vision. So the people that usually choose this lens are okay going back into full-time glasses, whether that be progressives or bifocals. The second option we have is a toric lens or an astigmatism correction option. With this option, we're correcting both the cataract, any near or farsightedness, and any astigmatism that might be there. The goal of this lens is to help you achieve good vision in the distance without glasses. So in your everyday activities like driving and walking around and being outside, you don't really need glasses. The only time you need glasses is for your near activities, say your computer, your cell phone, or reading books. The last category of lens we call a full focus lens. The full focus lens can correct distance vision like the toric lens, but also has a range of vision to it. There are 2 types of lenses in this category. The first of these is a multifocal lens. The multifocal has the biggest range of vision of any of the lenses that we have. And that's from distance all the way into this casual reading range right here. It does that by having different rings in the lens, like the rings of a tree. And you just focus straight through those lenses. You don't have to look up and down like we do in bifocals or progressive lenses. So that includes distance, your computer, your cell phone, and a lot of the casual reading. So most people that choose this lens don't wear glasses for many things. If you need them for very, very tiny print, or maybe seeing something very close, sometimes you need some over-the-counter reading glasses for that, but most of your activities, the people that choose this lens don't wear glasses. Now with this lens, there are different rings in it. So at nighttime, if you were to look up at a bright light, or maybe with headlights, you'll see a faint ring around lights. We call those halos. That's innate to the lens itself, so everybody that gets this lens does get a certain element of halos at nighttime. Not during the day, but at nighttime, most people do see those halos. Most people report that they see those most prominently at first, and then they fade a lot over time, but you will get a certain amount of halos and rings at night with that lens. The last option we have is an extended range of focus lens. These lenses also have a range of vision, not quite as much as a multifocal lens, but usually from distance to intermediate to a little bit of close. But if you're pulling it in to read a novel or something you need to see tiny print, usually you'll need some over-the-counter reading glasses for that. The advantage to this lens is there are no rings in this lens. So if you are out at night, you're not going to get the induced halos or rings around light. These are all good lenses. There is no good or bad, right or wrong. They're just different. And which lens is right for you comes down to what your vision goals are long term. This is a long-term decision. This is a lens you're going to use every day for the rest of your life. So we'd like you to take your time and think about what you want to get out of this long term. For many, the choice to invest in the vision for the long term is the best investment they've ever made. Many think about how much they save in both contacts and glasses over the years. Our role here at Texas Vision is not to tell you which lens to get. It's to help you understand the option and make the decision that is right for you. Here at Texas Vision, we believe that life is beautiful, and we're just here to help you see it more clearly.